No, not yet. We're not live.
I don't know, are we not?
No.
Here's the camera.
Hello. Sorry, I'm just used to the camera here. Also, look, it's loading.
Yes, it is, but I want to check something.
So, we're live. Hello.
Are we? Got it. Yes, we are.
Hello, we're live.
Hi, everyone. Good morning, good evening.
So, what are we on? Skin sites?
Yeah, it's going to be skin sites, but we're going to wait for people to get on. Let us
Okay.
know
Where's your little
if you
cheat
can hear
sheet?
well. My cheat sheet is exactly where it needs to be.
In docs?
Yes, it's in docs, but
Checking messages.
people at work are sending me virtual espressos to help me stay alert today. Hi,
Had a really
everyone.
bad night.
Sorry we missed last week. I was very ill and I'm still recovering, so this is gonna be fun.
Isn't it?
But definitely say hi. Tell us where you're watching from. Jenna,
Hello,
hi.
Hello.
You saw that?
Yeah, I saw that.
Good.
Right there.
Yeah. Well, so he and I shared a sickness.
Yeah, dengue.
Yeah, we both had dengue. So we need to
No
get to work in the
platelet
garden.
dropping. No platelet
I know we've been
dropping.
very lucky.
Yeah.
We've been very
Papa
lucky.
had
Oh,
dengue.
thank you for the feedback on the audio.
What about the pop dengue? No.
No, your dad had a dengue-like flu.
Huh.
We had dengue, which is, I think
Not
in the States
great.
people have an easier time saying dengue, but it is dengue.
Dengue.
And yeah, today we'll be talking about Maskne and Maskitis, which is really cool actually because, thank you, Eliza, and morning case. I'm speaking to the wrong camera. But yeah, so
Yes,
there's
you
a
are.
lot in Maskne and Maskitis, which is kind of a new term that got coined since
Oh,
the last time we talked about
By
this.
the way, can you hear the like of the fan? Because we just installed a new fan.
We did.
Because we were hard of breeze here.
Hard of breeze.
I'm trying, but you're lacking a little breeze. So whenever you turn it on, it just goes over here.
I think it's fine. I
Okay.
think we're fine.
But can you hear it?
I can hear the.
I know. Choo choo.
Well, how is everyone?
How is everyone?
For those of you in the States, it's been so cold.
We haven't been online for 215 hours.
No, I don't know what that means. Maybe that's minutes. And we're waiting for vaccines over here. I hope
Yeah.
everyone is thinking about or has registered to get their vaccines. Here we're going to prioritize my mom and my sister, who is now officially a frontliner, spending a lot of time in
Oh,
hospital.
by the way, do we have any coupons to give out?
Not today, I don't think. Not today.
I'll give out a coupon. I'll like comment.
Okay, so no one can hear the fan.
Okay.
You want to say thank you
Thank you.
to me?
Yes. Thank you.
I
I can't stay for long because my teacher.
know. You know what I need is a shot of adrenaline.
Oh,
Tell me a joke.
Let's see.
No pressure or anything. Nothing?
What's the best thing about Switzerland? I don't know, but the flag is a big plus. If you don't,
These are awesome.
I know.
They're the worst jokes ever. But they'll help me wake up. Okay, so we'll start in about a minute. We'll just wait for a few more people to come in and then we'll get started talking about Maskne.
I have another joke.
Okay.
Did you hear about the mathematician who would stop at nothing to avoid negative numbers?
Oh my god. Oh my god. I'd like to officially apologize for this moment in time.
And Mama,
Yeah. Yes, dear.
what did the fish say when he was swimming up the dam? Up.
No! You messed
No,
up
I
the
messed it
joke.
up.
That's
No.
okay. All right, I'm going to start. Welcome, everybody. Again,
Welcome.
apologies that we missed our live stream last week. I was very ill And I'm still recovering from a
I have
mosquito-borne virus, which is the same thing he had.
I have another joke.
Okay, later. So
Okay.
today we're going to be talking about Maskne. We've
And-
actually covered Maskne quite a bit
Yeah.
in another live stream, but also in a video on YouTube. The thing is, there's a lot of new stuff,
So
and we'll also be
this
talking
is,
about
no idea. Maskitis.
maskitis.
So this is our skin sites on Maskne and Maskitis, and it's an update.
It's an update. So
Remember
please remember.
to ask your questions in the comments early so that we can answer them before the end.
Especially for VMV related stuff, ask them early while I'm here, because when my mom's on, who is our founding dermatopathologist, we really tend to focus on skin when she's here. And don't forget, please, to
Like us on Facebook,
follow us on Instagram.
subscribe to our YouTube channel.
There you go, and hit the notification bell. Apparently we now have choreography, so
Yes.
this is cool. And say hello for sure. Tell us where you're watching from, because some of the information that we share can actually be catered to where you are, because things are different sometimes.
Yeah,
in the
so
cold
like
or
in
the
Russia,
heat,
it's cold.
for example. But it's also like 4 in the morning in Russia. So
And
I doubt
definitely
that's-
comment with ideas of other topics that we can talk about and cover.
Exactly. Next week, I think we'll be talking about the microbiome, but
Oh,
we'd love to hear what else you guys would like to know. So, getting into our topic for today.
Wait, I have a question because I have a question.
Okay.
So what if we did like a not skin site, but like something that causes a skin condition?
Like
So,
what?
like-
What do you mean?
Well, I'm just going on a limb here. I don't
Okay.
actually know if this causes a skin condition. So
Okay.
Don't blame me if I'm wrong. But like, how does a cell produce antibodies?
Okay,
what
so
is the
something
DNA
a lot
about?
more. Okay, that's well. I'm sure there are other live streams that can that can cover that just as well. But when we're here, we're going to talk about skin because that's our specialty, and that's what your Lola
Then
does best.
what causes it?
Okay, we can probably get into that. If you guys want to get into a deeper understanding of skin, we can cover that. But for today, we're going to be talking about Maskne and Maskitis. And Maskne, I think at this point, is fairly well known. People use the term all the time and they know what Maskne is. But actually don't think it's well understood. And if you could see some of the cases that my mother is caring for now, it's pretty amazing. So we're going to be getting into this
No.
in a lot more detail with my mom, who's our founding dermatopathologist, and she tends to see the more difficult cases that tend to get passed along because they're not clearing, et cetera, because she's who she is. So we'll be hearing some of the more interesting cases with Maskne. Some of the things that we know already, Maskne can be caused just by wearing a mask. And sorry, I
So-
actually used that yesterday, so you can't use it. But
Oh.
just the material rubbing against your skin for extended hours, just that physical friction is enough to actually cause maskne and other issues.
I have to go.
Okay, bye, honey. And maskne, we also know now, can be sweat acne, which is, I'm doing this because it's not actually an acne, it is a folliculitis, and it is caused by Malassezia, which was once called Pityrosporum. So it's Malassezia folliculitis. Malassezia is a fungus that lives naturally in our skins very happily, but sometimes can go a little overboard. And what we tend to see is under the environment of a mask, you're wearing that and you're occluded. It's tamped down for many, many hours in a day, and it gets very hot and humid. And so you have this proliferation of sweat, and so Malassezia can get extremely happy and cause the folliculitis. This is another very common cause of maskne. And the one that I think freaks people out the most, but it's kind of cool. I don't know if it's cool, but it's interesting, is maskne caused by Demodex mites. So we naturally have mites living in our skins, again, very happily, very naturally, very fine. But in certain conditions, they can get a little energetic. And so we are seeing more maskne that when you do a scraping, it actually turns out to be an overproliferation of our Demodex mites. So as you can imagine, you're not just dealing with, let's say, clogged pores, a bacterial infection. You could potentially be dealing with fungus, or mites, which obviously would require different treatments, right? Not just antibacterials. So my mom's been seeing more types of maskne, and I'll ask her about this one particular case that I thought was stunning because it was with a bacteria that also was usually very innocuous, really friendly, not a big thing, that kind of went really on overdrive. And the suspicion is because so many of us now are immunocompromised because so many of us have been stressed for so long. And stress is inflammatory, and stress really wreaks havoc with our immune systems, which can make us more susceptible to normally fine bacteria, right? So it's going to be interesting. The second thing we're going to talk about today is maskitis, which is a term that was coined by Dr. Dennis Gross. And it's really contact dermatitis as opposed to acne due to wearing masks. So instead of acne or bumps, folliculitis, what we would see is redness, rashes, but possibly even abrasions, actual wounds, which my sister just did a video on YouTube on the regimen that she uses. She has hyper sensitive skin, and wearing the mask actually gives her wounds and abrasions. So she shares some of the tips that she does to deal with that. So before I call my mom in to help us understand this more, I'll share how VMV can help, right? So many of our products contain monolaurin and virgin coconut oil, which are, I'm sure you know at this point already, very effective broad spectrum antimicrobials. So they're great at dealing with not just, let's say, a bacteria there, but fungus, etc., etc. All our products are non-comedogenic and non-acnegenic to help with that. And being allergen-free, our products definitely help prevent contact dermatitis from masks. And monolaurin and VCO are also anti-inflammatory and can actually help heal those abrasions and irritations. You can shop all our products, most of which contain monolaurin, plus our clinically published organic virgin coconut oil, which is actually this puppy. And you can see an abstract of one of our published studies right on the label at vmvhypoallergenics.com internationally, or vmvhypoallergenics.ph in the Philippines. And for World Compliment Day, I don't know if you guys know this, it was March 1, so sending out a compliment to everybody. We think you're skin-tastic. On both vmvhypoallergenics.com and .ph, we have awesome specials where you get 10, 15, and 20% off when you shop. And this ends on March 7, so definitely look that up. And in the Philippines, in our clinic, they're still offering the special bundle, which is the Skin Safe bundle, which has 2 of the Superwash 250 ml hair and body washes, plus monolaurin pellets, which we use in the house. We take them every day, basically, especially when there's a risk of infection, and the virgin coconut oil for a very, very special price. So check that out as well. If you would like a teleconsultation with my mother or any other doctor or nutritionist that we work with, drop us a PM and we can help make that happen. And for everywhere, remember that if you're having a hard time finding products you can use, you can drop us a PM or you can contact us and share your patch test results with us, and we can customize recommendations for you based specifically on your allergens. So one last thing before I call in my mom, remember that a mask is a unique environment that most of us, unless we've really been working in a hospital setting, for example, haven't had to deal with every day. So we can totally expect changes, right? It's a big change because now we use it for hours and hours and hours and every day. It's hot and humid under there, and there's a lot more prolonged exposure to materials that could be allergenic or that could be comedogenic, plus pressure against the skin that most of us haven't had to deal with on a daily basis. So if you're noticing acne or skin problems that are really stubborn in the mask area, don't guess. Schedule a teleconsultation and make sure it's handled properly, because as I mentioned earlier, it can be so many different things. All that said, please wear your mask. And apologies if anyone's watching from Texas, and if I'm going to offend anybody, wear the damn masks. They're important. Until most of us are vaccinated, please wear your mask. So now I will call in my mom, Dr. Viralia Rowell, to explain, because there's so much cool new stuff that's happening. I'll call her in to help us understand more about maskne and maskitis. No. So, Hi, everyone.
Hi, everybody.
So, hi. How are you? We're both in red lips today. I didn't even know.
Red and red.
Okay, so in addition to being a multi-published expert in contact dermatitis, Dr. Viralio Rowell is also a clinician who sees some of the toughest cases. And what's been interesting is she's seeing really wild cases of Maskne and Maskitis now. And so I thought she'd be wonderful to bring in and ask about this stuff. So say hi to everyone.
Hi, everybody. Hi, everyone.
So yeah, we'll start it off by basically, I kind of gave a little bit of an overview, but I think it's different when they hear it from you. You have room, huh? You have all this room.
Yes.
Why don't you
You mean
scooch
to
over there so
I
you're
can scoot
comfortable?
here?
Yeah,
Oh,
you could scooch a lot more over
I like
there.
it here, then.
Oh my god. Okay, scooch. Scooch.
Scooch.
I want room. Scooch. Okay.
She wants her personal space. Okay.
What is Maskne?
All right. Jesus.
What can Maskne be?
You know, when she told me that I was going to be, we would be talking about masks, as usual, I don't take things for granted when I come on live stream. I really look up the literature, what's latest and all of that. And I found some fantastic articles, one in particular coming from Singapore, from the university there. And if anybody's interested in this very long paper,
We could put the link or we could
I
put the
lear-
title later.
I learned so much about masks, the making of the mask, the destruction of masks, how to disinfect them and all of that. And but it's, I think, very important because this is going to be part of our wear for
A while.
quite a while.
But so Maskne can be several things. Can you scooch a bit because the mic's not going to be able to pick you up properly. Okay.
What's this, though?
It's a mic.
Okay, hi.
Okay. Anyway, I totally got discombobulated by that. So I was saying Maskne can be several things. Maskne can be clogged pores, right? Using comedogenic products, and then in that hot, humid environment with the sweat and whatever, you just clog the pores more. It can be a typical acne bacteria, or it can be malassezia folliculitis, which is a fungal thing, or it can be mites, Demodex mites, kind of going bonkers, right?
Right.
But if I understood correctly from watching the cases that you're sharing, you're also seeing other rather unique or rarer things. Like you had a Klebsiella
Oh, yeah.
situation.
I had somebody who had Klebsiella folliculitis in the chin. It was really...
So something about Klebsiella that you all need to know. This is the one that lives naturally with us, or is this a superbug?
Basically, it's in fecal material,
There
in
you
the
go.
ground, in the soil.
But Klebsiella is also one of those things. There's a wonderful New Yorker article years and years ago that was talking about antibiotic tolerance. And MRSA, right, was one of the classic thing that you talk about when you talk about antibiotic resistance. But also Klebsiella came up as a hospital superbug
Right.
because it can be more resistant. And what was interesting to me in this particular case is what really looked like acne was all around here, right? And under the nose and really concentrated on this area. And it got so bad that it actually looked necrotic, like there was dead tissue.
Listen, I get to see some really necrotic lesions. I'm currently taking care of somebody who's had it since 2012, recurrent, and then bingo, a really bad flare-up in the past year. It can...
And I felt that this was important to share now because there were several factors that were at play here, right? Which one is this particular patient was not a believer in antibiotics, period. And was a huge believer in a very healthy lifestyle. Vegan,
Which is
everything
always good.
organic.
Until it's needed,
Right.
if there's an organism
Right.
that's living there and proliferating, increasing in numbers and plugging the pores and making these necrotic lesions, you got to address the thing to get
Right.
rid of it, and you can't do that except with antibiotics.
Right.
Not long, not years, but about a month. We start with 10 days, 14 days, and if it's still there, then make it
Right.
longer. Or
So I guess ultimately for me the lesson of that particular case is, number one, there are more organisms at play, I think, than maybe in the past where we weren't using masks so much. There are more potential organisms to factor in now,
Yeah.
right? It's not just acne. It's not just sweat acne. It's not just Demodex mites. It actually might be a superbug that we just don't normally see. But
That's
because
right.
of the unique conditions
Right.
that we're in now, we're seeing these really rather holy Moses situations, right? The second lesson that I'm getting from that is we all want to live a healthier lifestyle precisely so that we can avoid drugs as much as possible. But if you need it, you need it. Because otherwise you can have more serious risks.
That's right.
Right? Okay. So that was one example I wanted to share with you guys. But otherwise, what else are you seeing now in Maskne that's kind of
Okay.
new and interesting?
Laura was talking mainly about the organisms, right? That are really interesting in that there's a name, for instance, which you'll recognize. It's called incognito. In other words, tinea versicolor or fungus, that is those little white spots that appears in the back with sweating and all of that. It's tinea versicolor. And then there's the fungus, which has round circles that occur in other parts of the body. Well, that's very common for us dermatologists to see, or rather to recognize, and that's the way it is. But with COVID, it seems there are many, and it's not. It seems it's been reported in a number of articles already as well, and we see it in our clinics that the fungus fungus organisms and bacteria seem to be in various areas which they normally are not present, and they are different in their presentation from how they usually look. So there's such a thing now as tinea, which is a kind of fungus, incognito. In other words, it's different from how it normally looks.
It's not obvious.
That's right.
Yeah.
There's also a malassezia.
Oop, we got a
Incognito.
helicopter. Can you guys
Hello
hear
there,
us still?
guys. I hope you're bringing back some vaccines.
I hope that you can hear us.
Can you hear?
That's pretty loud. I think we're okay because the mic is right there. But okay.
So then there's also the malassezia, which is another very tiny yeast-like
Fungus,
fungus, which normally is fairly innocuous. And there you are, you have malassezia incognito. Then you have this Klebsiella. We are, together with the functional doctor of my patient, we're still trying to figure out why it's a very recurrent thing. It's been cleared a number of times in
But
the
it comes
past,
back.
and then comes back, and it's
Yeah.
there. And I'm thinking, where is it coming from? Well, she eats a lot of vegetables, and she may be washing them with her hands, which may not have gloves on, and because
Thank
they're
you.
probably organic, and maybe some farmer out there thinks that organic just means you get the fecal material from whatever and just put it in the soil and let the soil eat it up, and it's part of the fertilizer. Hopefully not, but these are the kinds of things that
Right.
we go beyond the dermatology part and have to look for where are the sources of these organisms from.
So there's really a lot of investigation.
Yeah.
So particularly if it's stubborn, please don't self-diagnose. Really do talk to a doctor already, because as you can see, even the mega specialists have to dig deeper and look into different things, right? You want to talk about the mask materials,
yes,
right?
I would
Okay.
like to talk about mastitis. Is that how they call
Maskitis.
it? Maskitis.
Dr. Dennis Gross coined it. So it's a contact dermatitis as opposed to an acne
There you go.
or acne-like thing.
Yeah. So we have
Yeah.
Maskne, which is the acne thing thing that we were talking about, and then there's the mastitis.
Maskitis,
Dr.
yeah.
Gross. Well done. Well, this is not a simple thing, by the way. There's a science to the development of these. There are 3 layers to this
That's the
particular
camera.
mask. There are 3 layers to this mask. On the outside, which is colored green, is the hydrophobic. In other words,
You see
this-
that as green? I see it as blue.
blue. Okay, that's blue.
Okay.
Okay, I have a different funny way of looking at colors. So anyway, that blue material is hydrophobic. In other words, it's supposed to be a material, it is a material that repels
Water.
the saliva, the water,
Liquid.
the things that are bringing the COVID or any organisms into your area here. So that's hydrophobic. The inside, however, is hydrophilic. In other words, the material here is, if you look, it's really quite different from the outside. It's more, porous, because it's supposed to absorb the moisture, whatever
Your spittle.
your spittle. I like that word. the spittle that comes out, and perhaps even the breathing, and there's some material there as well. That's what it is. In between is the third layer, the second layer rather,
In the
is the
middle.
most important part, because in addition, it is made of a fiber which is not cloth. It's not cloth material. It's actually made from polypropylene is the kind, and that's a form of plastic. And the way it is done, it is also a science. There's many ways of making this particular plastic so that it's very tightly woven, so that gives you at least a minimum of 95% protection from the organisms that come in and out. Okay, so now,
Let me just
addition,
run
however,
through
not
that.
yet, let me finish this.
Okay, but you said
In-
3 layers, right?
Yes, the 3 layers are the hydrophobic,
Hydrophilic,
the
this plastic thing
and
in
then
the
the
middle.
plastic thing in the
Okay.
middle. Now, the problem here now is that many of the makers of this, or who try to follow this, will put on also a disinfectant chemical into this area or into that area. So if you touch that and you touch this, you can then produce one way of getting a dermatitis here. It's from the chemicals that are used to innately make this a self-disinfecting
Right.
product.
Okay, so we're clear, right? We're
Okay.
now talking about contact dermatitis. People think that this is a very specialized condition that no one has.
Okay.
Everybody has contact dermatitis at one point or another. I'm going to go on the record and say everyone has contact dermatitis at some point or another.
Either
Not
an irritant or an
yes,
allergy.
not everyone gets an allergy, right?
That's
That
right.
was our last live stream. We talked about allergic versus irritant reactions. But I will bet you money. I'll bet you $1 right here, right now, 50 pesos, whatever. Everyone will experience a contact dermatitis at some point or another. And especially with something like masks, where you have, right, these specialized materials that you come into contact with, plus the disinfectant, and many disinfectants are allergens. The chances are you're gonna have some problem. Not even to mention the elastics, right? Many people are allergic to elastics. So that against your skin, and then the pressure of just keeping that on all day like this, chances are you're gonna have a problem at one
And that's
point or
not.
another.
That's only the beginning, by the way.
And there's more.
Yeah, there's more, because the material itself can be an allergen or an irritant. For instance, there's a wire-like material here, right, which maybe have nickel in it, so that you would get a dermatitis right across there. And in addition, that middle layer that I was telling you about, which is polypropylene, these are the polyesters. They are really plastics. And unfortunately, we have become allergic also to some of the acrylics, the plastic materials. It's one of the top 80 allergens that we dermatologists do in our patch test tray. So plastics can. And why is that a problem? Normally, it isn't really a problem until there is degeneration of that plastic inside. You see, if it's really well cured already, it's okay. But many people wash or don't throw this away. It's supposed to be used one time, but it isn't, because there's just a dearth of masks nowadays. And so we go to the problem of disinfection. What kind of disinfections are there? UV light is excellent, but not everybody can afford it. But if you can afford it, it's a fantastic way of using disinfection for this. Except, again, you must remember that any kind, including UVC, that is below 290 nanometers, lower, than, anyway, the UVC, it can, any of these cleansing methods of these, if you disinfect them in order to reuse, they can break down the bonds so that the pores between the plastics can break open more,
Okay, point being,
and therefore get bacteria or virus in.
there are many possibilities for a reaction when wearing these masks. I actually want to address. We had we had someone here who was a COVID denier, who wants to say not to wear masks, don't wear the diaper because everyone recovers from COVID, and to stop with our agenda. So the only agenda here is peer-reviewed studies. on
I'll send you
on
this
keeping
study.
you healthy.
Yes.
So for
This
others
is
there,
really a terrific study.
for others there who
who's
are
the non-believer, I'd
concerned,
love to send it to him.
there's so many studies out there, really and truly. Remember, we also did a live stream on what to trust, and you want to look at peer-reviewed journals. There is no individual on the planet who's going to know more than the thousands and thousands of doctors who've dedicated their lives to research, and peer-reviewed studies are a very reliable filter for what you're going to believe. And they, at this point,
Mask.
are very clear about wear a mask. It is really sincerely one of the best ways to prevent infection. COVID-19 can be a nothing for a
Prevent
lot
and
of people.
spread the infection.
Can be a nothing for a lot of people, but for a lot of people in the population, it is extremely dangerous and deadly, and we all want to get over this pandemic, so wear the damn mask. So anyway, going back
So,
to this.
Bottom line,
Yeah.
the materials themselves, therefore, of the mask can be a source of allergy. So, let's talk about how you disinfect, because many people are now using.
Before we go to the disinfection, can we actually spell out the different types of masks? And then we have some good questions about how to clear. So we have this typical mask,
The N95 surgical mask.
and as you can see, it does have blue colorant.
I'm sorry, the surgical mask.
The surgical mask. It does have a blue colorant. As Dr. Laura mentioned, you do also often have a disinfectant in the middle there that you might come into contact with.
You have a
do
metal?
have a plastic and a metal that is, if you're allergic to nickel, this might be a concern. And certainly the elastics might be a problem. For cloth masks,
And then the disinfectants that are
I mentioned the
innate
disinfectant. So,
and used to clean them.
right. So if we're now talking about cloth masks, right, they may not necessarily be safer. It depends. So this one is pretty stretchy, right? So again, if you're allergic to elastics and spandex, this will still be a problem. Second is it's quite dark, right? So it probably has a dye in there. You might want to opt for something that is paler, is less stretchy in material, right? This actually doesn't have much of a give at all. Just make sure, of course, to check for how well it protects you against disease. But those are, oh, and these things are gorgeous, but I mean, the lining is synthetic and black. So chances are there might be something to help the colorant bind there. So just watch out. Not everyone is allergic to these things, but you might be. If you know that you've patch tested positive for dyes and colorants and metals, something like this might not be your best
And
option.
the thing about this cloth, they sound very good, you know, and there is something about them, except that the pore size is too big for the, I won't give you the numbers, but for the very tiny viruses that
Yeah.
can get through those pore sizes. You need something that is really much tinier, like the ones that we're talking about in the surgical mask. So then, therefore, in addition to that, the washing, the using of soap and water, the using of the rice cooker or the microwave oven or whatever people think they can disinfect it with, or the using of certain chemicals, put it in, and all that, they can make those pores even bigger. And so that you're putting on the mask thinking, I have a great mask, it's been washed and all that, look, it's shiny and all that, and it's really not protecting you at all. So please be assured, please think about it some more.
What should people
wait.
look for?
In the materials, Laura already started to talk to you about the fact that the dye, because you sweat a lot after all, and the dye material can go, the presence of tiny little wires that may have nickel in it, and nickel is one of the most common allergens.
It's the top
You know?
contact allergen
So
still.
you have to be more careful about these cloths, and now the pore size in particular. So there is, however, a very nice part of that article I was telling you about, which talk about the fact that if you combine two surfaces of cloths, like combining 100% cotton, white of course, 100% cotton with silk, 100% cotton with
Interesting.
chiffon, 100% cotton with felt, okay? They have a difference in the texture and in the way they're made.
In the weave.
And one, the cotton is more mechanical protection, whereas the other one is kind of like electrostatic kind. So they kind of help, therefore, in giving you a little bit more protection. I
Okay.
say all
That's
these.
new to me. That's kind of
I
cool.
say all these because many times I have people come with mastitis and they need the mask, right? And there are still no good ways of being able to protect yourself from from the mask. So I continue to tell them the surgical mask is still the best, but there are, as you heard me talk about a little bit earlier, they still have certain objections to it. All of those 4 layers I was telling you about, that is innate to the mask itself, that will also degenerate with washing and drying and all of that.
You don't wash a
So-
surgical mask.
I mean, microwave therefore, or putting in the ultraviolet light. You know, they do. The pores get bigger. So what I teach them is that you can use your cloth mask as a shield. Get a white one,
Right.
put it underneath, and then put your surgical mask on top of it. That
So-
way you
yeah.
are confident about that, and you have that cloth. And now that I've read about the differential of using a very thin 100% cotton, right? A 100% cotton material, and putting on a thin piece of silk as well, that double layering, you will have a protection that will go like that.
Okay, I'm
Then
gonna break.
lastly,
Okay,
you want to break?
I do want to break this down
Go ahead.
because there's a lot here.
Okay.
So, a couple of the things we've learned so far, right? That maskne isn't always acne, and we have a question earlier. One of the first ones actually from Erica. No. Here we go. Sorry, no, I lost it. I'll have to look again. But we have different types of organisms that can be causing the acne or acne-like lesions, right? That can be typical acne, which would typically start by using comedogens in your skincare, for example, and under that hot, humid mask, you're sweating, and so you start tamping down clogging the pore, which
Correct.
can then cause inflammation, infection, typical bacterial acne, right? But because of the unique world that we're living in now, you can also have the fungus malassezia go a little hyper
Right.
under that hot, humid thing, and that can cause malassezia folliculitis. Demodex mites can also go on overdrive and cause that problem. And because of immune issues that we're seeing from, you were mentioning chronic stress, we can have bacteria like Klebsiella, which doesn't usually present like this, or certain fungi all of a sudden present in new and different ways. So when you're seeing acne, especially when it's very chronic, do see a specialist, do see a dermatologist at this point, because a scraping might be needed. It doesn't hurt, it sounds awful, but a scraping might be
It's
needed,
even called acne surgery,
which sounds even worse. It's not at all painful, right? It's a light scraping to really accurately identify what is the bug. What is at play here? Because you can't just take all these different medications or apply these different topical things when it's a very specific bug that requires a very specific thing. So it's one. Two, my mom broke down really well, I think, how masks are made, right? And why they can cause either acne, acne-like lesions, or contact dermatitis, redness, rashes, itching, and even abrasions, correct? So some of the tips that she gave, and I love that too. Hi, Suzanne. Shout out to Suzanne, who's an
Hi,
awesome
Suzanne.
esthetician in New York. Check her out. What I love that her tip that she just gave right now, we do have to wear a mask. Period. We're in a pandemic, so it is important. If you are experiencing skin problems, a great way to protect yourself, no, is to kind of add a barrier by putting a cloth mask under the mask. So your skin, cotton, your skin is in contact with something that is safer, right? That's under the mask. And this also provides
Mixed with silk.
additional,
Try it.
so cotton, silk. Again, some of the things to look for is nothing too stretchy, nothing brightly colored or dark colored,
Nothing colored at all, just white.
white, or ideally even natural, unbleached would be best. So there, so far so good. Is everyone still with us? It's a
I'd like
lot
to
of
go back
information.
to how to clean it.
Okay,
First thing is when you clean masks that are supposedly with organisms in it, wear a mask and wear your gloves. You have to protect yourself from it as well, right?
yeah.
And the methods that I found very helpful is really the ultraviolet, the UVC, but you have to read the instructions very carefully, because if the intensity of the delivered by the UV is too much, you'll destroy the pores.
Mm.
If the duration of the treatment is for so many minutes, follow it to the letter, because that's really all that it needs. If you go longer,
You'll
it can-
degrade.
you get degraded, so it can be degraded as well, not as quickly as with washing and for these things, but it degrades. Another one that I found excellent is the use of vaporization of hydrogen peroxide, which I even found better in a sense because it's simpler to use at home than the UV. Because with the UV, I know people who say, we have a basket, so when we have the UVC on top of it, and we place things that we use and put it there, and he said, we walk away and then we go back out and then. The problem with that is that you're really not disinfecting. You're not disinfecting the problem area and the problem area because you're only exposing this to UVC.
One side, right?
It's got to be done properly. That's what I said. Follow the rules, okay, about intensity, duration, as well as this, and how often you can probably use the UVC for at the most 7, 8, 10 times, if that. Okay. Now, the other thing that I just found that I told you that I kind of really like is the hydrogen peroxide, a common enough chemical that you can get from the store. Put it in a vaporizer, and
So cool.
as a vaporizing material, it doesn't really do the pores so much. There's not that much pressure on the pores, and at the same time, it really permeates the mask that you are using.
There you go. And it's
But-
nice and affordable and very easy
nice
to get.
and affordable.
Okay, so we got to get to questions because we have several really nice ones. Nona Torres, is that Dr. Torres's
Yes.
daughter? Hi,
Nona.
It's good to see you. Okay, so we have a nice question. This Erica has been asking because it seems to be stubborn. Erica, correct me if I'm wrong, right? The best way to cure maskne on the jaw, especially if it's recurring, and she's tried different things that seem to be working when they get bad, but she just wants to know how to prevent the maskne from recurring. And it seems to be, if I read her right, on the jaw, right?
Okay. If it's on the jaw, you may have to consider other causes in addition, of course, to your mask. The reason I say that is it's just putting on my mask, and really mainly
Okay.
you're covering this area, and in the jaw it's probably the chin, but not this one. Now, if you're getting acne along the jawline, you know what that jawline area is? It's really sweat, right? So if you're exercising or doing anything where you're sweaty on the scalp and the sweat runs down, or you have long hair and it runs down and goes there, that may be actually sweat acne.
Right.
It may be because of the friction, the pressure of the hair going there, as well as a bandana or something. But consider, if you wish, your mask, but also consider other causes, in particular associated with sweating.
Someone is asking, and I was just about to ask the same thing. Chella was asking, could that also be halogen acne?
Halogen acne is basically around the mouth area.
And chin, but it
Simply
can be
because
here, yeah?
it is the most, yes, of course, it is the one that is most exposed to the halogens. That's the fluoride from your toothpaste, the iodides from salty foods that you're eating. But you can also get halogen acne from drinking vitamin
Okay.
B12. And,
Yeah,
you
so
know.
okay, let me back this
So
up
you
a
can
little
spread
bit
it,
to
in other
help
words.
Erica maybe make a list. So first of all, Erica, I want to invite you to send us a private message because we tend to ask, we have a questionnaire of about 20 questions to ask more or less what are you exposed to, etc. And then we could probably give more specific suggestions. But of the things you've heard today, right, if it's really, really limited to the jaw area, we don't rule out sweat acne. Stuff from your hair care that might be trickling. I was starting to think even collars. She was saying, what else? Scarves. I mean, if you were in the States or somewhere else cold. But also in terms of halogen acne, this is interesting because fluoride, so a lot of the things are ides. Chloride, chlorine is everywhere, right? So we're disinfecting everything. Chlorine is typical in all the bleaches that we use now. And chlorine is wreaking havoc with a lot of people because it's a photoallergen, so it causes dark spots, But if you happen to be sensitive to halogens, this might be a trigger for halogen acne, right? Iodides, so iodine, fluoride in
Iodides are also
toothpaste,
salt.
salt. If you're eating a lot of salty foods, we tend to see that as well. And she was saying
The
vitamin B.
rainbow of salt
Yeah,
is
vitamin
potassium
B6
iodide.
and vitamin B12 are pseudohalogens and are known to cause this type of acne as well. So that might be at play. And you might want to consider, lessening some of that exposure. But let's maybe do a PM to try to really isolate it if it's that recurrent.
Also, a common treatment that we doctors, we dermatologists do, because it's very quick in improving acne around the mouth, the perioral acne, is injecting it with steroids. I'm sure a number of you out there in the audience have had injections with steroids. Well, they contain fluoride, the steroids, many of them. And so therefore, that fluoride acne may be from, not from the fluoride in the toothpaste, but actually also from the injection and the use of topicals that may have as well fluoride in them. So steroid
Yeah.
acne.
The good news I can share with you, Erica, is if it's so recurrent in such a specific place, it's actually a little bit easier sometimes to investigate because you really just run through very carefully an inventory of what the exposure could be. The skin is wonderful like that, I think. Okay, so
I have a good news part. Huh?
Oh.
There it is.
okay, one more question then, because Jana asked this earlier. Jana, who's awesome, we love it when you're here. I love your questions. Is it possible to still get maskne even if you don't wear a mask too often because you don't leave the house that often? I think it's
Yes,
a great question.
you can. Because it depends upon how it's initiated. Sometimes you just initiate it and then the other chemicals in the air will continue the process. Like Laura was saying, you may be using a mask, let's say, once a week to go to mass or, to go to church or once a week to go shopping. But, you come back, this particular patient I was telling you about who had this, one of the first things that happened was she went out to her site where she was working on something, and it was after that when she came back that bingo, the thing flared up all of a sudden. So yes, you can have even for short periods of time. So even because it depends also upon your allergenicity, your irritancy,
Yeah.
your how you've been already exposed to so many things in your
Right. If
in
it's
the
an
things
irritant,
that you're using.
Again,
If
we
your
talked.
barrier, in other words,
Yeah.
is already compromised to start with, then it's easy for a mask
It-
used for an hour or
Yeah,
two.
that might be all you need. Remember when we talked a few live streams ago about irritant versus allergic reaction? If you happen to be allergic to a material in a mask, right? It doesn't matter how long the exposure is, you're probably going to get a reaction. If you have an irritant tendency towards something in a mask, the threshold might take a while. For some people, it might be a week of wearing a mask. For other people who are really sensitive, say, to chlorine, because chlorine can be quite caustic, right? If it happens to be there or another disinfectant is in these things, then maybe the threshold is hit much more quickly. And you can experience that irritant reaction. And again, for my sister, she shared, when she wears these masks, these in particular, the area of contact with her skin, she gets wounds, straight up open gashes, which obviously makes it then much more susceptible to other irritations and other infections. So yeah, it's totally possible. So did you want to go and say
Yeah.
something first,
I
and then
wanna
we go to
talk
other
about the
questions?
fact that there is a future in a sense. I saw in one of these, markets. I'm not a good one in that, but I saw something that was advertised that I thought was interesting. The main thing that we're worried about in maskne and mastitis is that the thing goes in, and so therefore it really is
The pressure.
the pressure. But you need it to come out so that you can breathe, right? Well, this
Right,
adverti-
breathing. So when
Right.
you do that multi-layer thing, please make sure you can breathe. This is important.
This advertised a frame that you put on top that actually carried it and kept it in place. And this is the important thing. It was made, they said, of 100% silicone. 100% fully cured silicone is not considered an allergen at all. Unless, of course, you wash and destroy it somehow so that it breaks down into whatever. its ingredients. But otherwise, that. So it's something that I'm going to look into and try it on patients.
And we'll publish what we find.
Yeah.
We have more questions. We
And
don't
the
have a
last
lot
thing
of
that I
time.
want to talk to you about is, like I'm saying, the silver lining.
Okay.
This there are now being made transparent because we all want to be seen. We don't want. I mean, my lipstick should show and not be covered by that mask. You know.
Priorities,
Now,
people.
Yes. When I saw this about transparent masks and how it's going to follow
So
all the
funny.
dictates about how to make it in such a way that it's going to be easy, it smells, you can breathe in and out, it's comfortable and all of that.
Okay, we have
Something
questions,
to look
and you
forward
have to go soon, so I'm going to
Yes.
rush through this.
So,
Is there
I
a
have an 11 o'clock. I have
is
to go.
no
No?
no? We have questions. They're here for
Okay.
you. Is there a best type of mask to wear to prevent maskne? We tackled that already. I will
Yes.
repeat. If you can get the white or uncolored mask, that's better to begin with. If you're really sensitive, it's very recurrent, do her layering trick. Just remember you can breathe. So try satin or silk
Silk.
under a white mask as a
100%.
secondary mask, 100% cotton. Okay, Jelly is asking, what is the difference between maskne and normal acne? Because my breakout started in August 2020 and until now I have it. It may not be bacterial. So that's what we mentioned earlier. It could be a bacteria. It could be a really rare bacteria that usually doesn't cause problems like Klebsiella. It could be a fungus, Malassezia. It could be mites. So if it's that recurrent and you're really doing everything already for non-comedogenic, etc., a
See your
scraping,
dermatologist.
a scraping might be necessary, Jelly, just to make sure you know exactly what the organism is so we can target it better. Sam is asking, what are your thoughts on copper masks?
It depends. Again, copper is generally not an allergen. I take that back. There are contact dermatitis.
Generally
it is
not.
in metal.
Yeah, but it's not. You can have contaminants in some copper. That's the
Exactly.
thing.
It's never pure. Even nickel, for instance, will have cobalt on it. I mean, you know, because these, after all,
If you're
are-
allergic to nickel and cobalt, just have a little bit of care because
Yeah.
it is a metal, and metal does tend to have a lot of these other things. But pure copper is theoretically not a top contact allergen, right?
So when it says copper,
Really, how pure is
yeah.
it? And what else is in there? Is there
That's right.
elastics and all these other things? Chella's asking how to wash cloth masks for people who cannot use surgical masks. I
told
like
you,
this.
the hydrogen peroxide, I think, is
Hydrogen
a terrific
peroxide for
idea.
disinfection, but just for washing, I think it's so important to note, pardon me, if you use a laundry detergent with allergens or irritants, you could be adding to the problem because now
put
you
it
have
on.
this hot, humid thing with so much perfume coming at you,
That's right.
or chlorine coming at you, and that's added exposure all
Use
day.
a hypoallergenic soap, just
Yeah.
like you're using it on your face and body.
Okay, and Ish is asking, is it possible to have dry and flaky lips in one part due to wearing a mask?
Yes, I have seen
Yes.
people. It depends upon
Great
the shape of your
question.
lips.
Thank you.
I saw somebody whose lips jutted out, and so side view, I said, "This is the reason you're getting it here,
Mm-hmm.
because it juts out, and you can see the mask will be in touch with it." Much
So
more.
absolutely,
Yeah.
and those irritations on the
And there are
lips.
some people with the other opposite.
It could be so it could be on the upper lip, it could be on the lips themselves, and that could be flaking, that can be dryness, and that can even be hyperpigmentation, and it can even be blistering. That's how bad it can get, and sores.
Absolutely.
So definitely look at that. Look
Then
at any
becoming
lip balm.
secondary infected with virus and things.
There you go, and then we really have a problem on our
herpes
hands. There you go. Ooh, maybe that's another topic we can cover. Is
should
when
cover it.
when something like just a contact irritation or a contact allergy becomes related to a secondary infection and can then bring about or worsen herpes simplex, a bacterial infection. Oh, that's
Or
interesting.
recall
Yeah.
a previous herpes simplex.
Very interesting. Okay,
May I go?
10:54. She has a patient or she has a
No,
research thing.
I have an important meeting, but I can
There you
stay
go.
another 3 minutes.
Okay, so 3 minutes, folks. If anyone has extra questions, if not, I'm going to run through the other stuff that I don't talk about when she's here. Yes, I am. And yeah, the mites is honestly under a microscope. Demodex is really cute, huh? They're really cute looking mites.
Oh, they're very cute. They're the cutest looking thing with a head like this and with all of those feet going like that.
Yeah, but they're
My residents, when they come to my clinic and I tell them to go look for Demodex, and I said, don't stop until I tell you to stop. And they finally find one, they get so excited because it's the most fascinating looking creature.
Yeah. So
And they live inside our
in a
follicle.
nutshell, I think while
Especially
she's here,
rosacea.
I wanna have a witness to me saying this. Okay, many of the patients and customers that we see tend to really think because their skin problem is so recurrent that they have the worst ever. And it's never been in the medical books. It's just the worst acne ever, the worst ever, right? And it is very hardly ever the case.
You're not alone.
You're really not alone. And she's really seen patients, so she's had to hospitalize to get them off of steroids, for example, or hospitalized because they are legit extremely complicated cases. So the good news to everybody is really and truly, for even recurrent problems with the mask, etc., many times it's just proper investigation.
What caused it?
Yeah, where are the lesions and what is the cause? Is it a material? Is it
The
pressure? Is it the disinfectant? Is it what you're washing the mask in? Is it products that you're using that are leaching out because it's so hot and humid under the mask? Is it using the wrong treatment because you're using an antibacterial and it's actually a mite or a fungus? Once you it's a little complicated in the beginning in the investigation phase, but chances are you don't have the worst. You really don't.
Right.
And the scraping can really help. So I wanted to make sure I
To
got
me,
that out.
a word I hate to hear is idiopathic. As idiopathic sounds to me like an idiot.
Okay.
So I'll accept there are many things that we call idiopathic.
What does
but
idiopathic mean?
Idiopathic means we don't know what the cause is. And I just feel
It's like
in this day and age,
undifferentiated, yeah.
with all of the molecular and the genetic and all of those kinds of things that we're looking into, that there should be less and less of the idiopathic and more of the genius type.
There you go. Okay. Thank you so
Okay.
much.
Love
Have a good
you.
meeting. Love you.
You're doing such a great job, love.
That's kind. Okay, folks, you go
Anyway,
enjoy your meeting.
I will.
Thank you for this. I'll make sure that we type after the link to that really amazing mask article. And Gavin is here to say goodbye, everybody. Just a quick reminder.
I didn't say goodbye
She did.
to the others.
Oh, well, come say goodbye. Okay. We have a quick goodbye.
I said goodbye to Laura. I want to say goodbye to you all.
Okay.
Thank you for listening. Thank you for asking questions.
really
it makes
amazing.
me learn from you as well, you know? It's a two-way street. Bye-bye.
We have a good question. Ruth, I'm going to kill you. What a great question, but very last minute. Could breakouts in between the eyebrows be caused by the masks as well? Like the humidity escaping the mask?
I have no idea.
It depending, I guess, on the placement of the mask, right? Where that would be. If the pressure actually ends up, if there's contact that goes like that, then yeah, it probably could be. If you have comedogenic stuff that you're using here, and the sweat, is spreading there, that can add to it. So very quickly, follow us where?
Follow us on Instagram, also Facebook, and subscribe to a YouTube channel, turn on the
Yes.
notification bell, and like every video we've ever posted.
And check out vmvhypoallergenics.com internationally and .ph in the Philippines. And remember, we have all these amazing specials that are happening now. We're working our butts off to normalize our stock situation, so please stay tuned. And we do have specials at the VMV Skin Research Center and Clinic as well. And definitely PM us if you have had a patch test.
And we can customize recommendations
For you based on your particular allergens. And if you have a very stubborn, recurrent thing, drop us a PM.
And
I am not a doctor.
teleconsultation.
Yeah, but
Teleconsultation.
we have a very detailed questionnaire that can help you and your doctor further investigate what the cause might be. And yes, we do have teleconsultations that we can help you with as well. Otherwise, have a wonderful World Compliment Day and Women's History
I
Month.
thought that was yesterday.
Yes, so Women's History Month is March.
March, yeah.
That's right. Are you a feminist?
Yes.
Damn Skippy. Have a great month, everyone. We'll see you next week. Bye.
Can I end it?
You can end it, but slowly. There you go.
Beep. And
Beep.
then